Hello, and welcome to a new episode of the Network Voices interview series. In this series, we pair members of the Marathon of Hope Cancer Centers Network Patient Working Group with network researchers and clinicians. Before I introduce today's guest, Sheilah and I would like to take a moment to introduce ourselves.
That sounds like a good plan.
Perfect. So my name is Kirsten, and I am based in Toronto, Ontario. I hold a Bachelor's of Science and a Master's of Public Health. I enjoy staying active through hiking, tap dancing, and chasing after my beloved fur friend Winston. As a pediatric and young adult cancer survivor, I use my story to inspire and advocate for others, and I am an active member of the patient working group, contributing my insights to improve the lives of fellow patients. Sheilah, on to you.
Thanks, Kirsten. My name is Sheilah. I live in the town of Saint-Lambert outside of Montreal on the South Shore. I've been self-employed since 2019, and I work in the exciting field of email security and threat intelligence. I'm also a vocalist, and I do some voiceover work on the side. I'm a huge fan of Pilates and running, although running now is currently on hold. Like Kirsten, I'm an animal lover, and I advocate through volunteering and fundraising, and I live with my husband and 2 rescue dogs. I was diagnosed with stage 3 colorectal cancer in May of 2022, and because of a follow-up diagnosis of Lynch syndrome, I'm considered high risk, and I'm now in the observation stage. So while this diagnosis really doesn't define me, it has really changed me a lot in big and small ways. And becoming a member of the MOH-CCM Patient Working Group has really allowed me to share my experience, and I hope that it will help other cancer patients and survivors, because ultimately it's really helped me in untold ways.
Thank you, Sheilah. It is my pleasure to introduce today's guest, Dr. Kevin Wang. Dr. Wang is a medical oncologist at Princess Margaret Cancer Center. He specializes in the treatment of brain tumors and gastrointestinal cancers. His work focuses on integrating genomic insights into clinical practice to develop personalized treatment strategies for cancer patients. As an active contributor to the Marathon of Hope Cancer Center Network, Dr. Wang is dedicated to advancing collaborative cancer research and improving access to precision oncology across Canada. Thanks for joining us today, Dr. Wang.
Great. Thanks so much for having me.
To start off, so as an oncologist who sees patients on a daily basis, can you please describe what precision medicine in cancer looks like in Canada today?
Great. First of all, thank you so much to the both of you for sharing your stories. I would say that precision medicine in cancer is no longer a pipe dream. It is here in Canada today, and it is here now. I think to put it simply, precision oncology is really about giving the right drug to the right patient, and crucially, at the right time. By analyzing the genetic and molecular profiles of patients' tumors, we can now try and tailor therapies to target specific cancer features. Since we sequenced the first human genome now more than 20 years ago, we now know that cancer cells arise from changes or mutations to the DNA, which are essentially a set of instructions that tells your cells, how to do its job. Normally, there are very tight controls on how your cells divide and grow. But when there are these mutations, the cells can grow out of control. And at a core, that is what cancer really is about. So through decades of research, we're now beginning to build, or we're in in the process of building this catalog, to tell us which mutations are important, which ones occur by chance alone, and which mutations can actually be targeted with certain drugs. In clinical practice, what this means is that two patients with the same type of cancer might actually receive completely different treatments based on their unique genetic mutations and the molecular markers. This personalized approach not only has led to improvements in patient outcomes, which is very important, but also reduces unnecessary treatments and thereby reducing potentially toxicity. I treat some of the most, unfortunately, most deadliest cancers around, which are brain tumors and many types of gastrointestinal cancers. I'll give you an example. In brain tumors, we have not had a new drug approval for actually more than 20 years. And this past year, we had the first approval for a targeted drug blocking a mutated protein called isocitrate dehydrogenase. And that actually was work that started right here in Toronto. So this has now transformed how we treat these type of tumors. And we see examples like this all the time, which is really, precision oncology in action. Canada has really been a big player in research and is at the forefront of precision oncology. And initiatives like the Marathon of Hope, Cancer Centers Network is really aimed at bringing researchers and patients like yourselves together to accelerate the adoption of precision medicine and find more opportunities where we can use these targeted therapies to make a difference in a patient's journey.
Thank you, Kevin, and it's very nice to meet you. Thank you for being here. Could you
Course.
also share with us what some of the major challenges are in precision medicine today?
Yeah, I think there are several major hurdles we face in making precision medicine, a standard part of cancer care in Canada. And I think first and foremost, one of the big challenges we face is accessibility. Canada is a huge country, and there are lots of variation between different provinces. Some tests are funded, some tests are only accessible through research. So this is a rapidly evolving field, which really requires clinicians to be up to date, and engage with the current research landscape. I'll give you an example. As I prefaced before, the goal of precision medicine is to be able to give the right treatment at the right time. Currently, we typically only profile tumors at a single time point, which is often at the time of initial diagnosis. Now, obviously, this fails to capture changes to the tumor over the course of treatment or, from diagnosis to and possibly at the time of recurrence. And obviously, these profiles of these cancers can actually change quite drastically. We now are seeing the emergence of new technology. I think, Sheilah, you alluded to this, circulating tumor DNA. We can use that to actually track the tumor in a minimally invasive way, such as through a simple blood draw. So we know that tumors shed their genetic material into the blood, and now we can track these changes in real time, which really provides a powerful way to try to detect early recurrence, for example, or see if the tumor has acquired, new mutations that may now be amenable for targeted therapy. So this is, I think, the power of precision medicine, and we'll see, technologies like this and many others trickle down over the upcoming years and begin to impact patient care. Um, I think what we really need is continued investment in research, and not just that, but also infrastructure. Through the Marathon Hope Network, for example, and ultimately policy changes so that we can make precision medicine more accessible. I do think Canada is in a strong position with national initiatives like this, but we really need to ensure that these advances reach every patient, regardless of where they live within Canada and or their financial situation. And I think by addressing these barriers, hopefully we can make personalized cancer care really a reality for all patients.
That's really encouraging. Thank you. I know that you're involved in a number of projects in the network. Can you tell us how your research is specifically addressing challenges, excuse me, that exist in precision oncology?
Yeah, absolutely. My research is really focused on leveraging these sort of new genomic technologies to tackle some of the most pressing challenges in precision oncology. I was very fortunate to have been awarded a data science award this past year through the Marathon of Hope. And the challenge we try to address with this is, even though the cost of sequencing is come down quite significantly, it still costs, unfortunately, thousands of dollars to comprehensively profile a patient's tumor, let alone doing this at multiple time courses, throughout a patient's journey. So one area of research has really revolutionized the field is looking at something called pathology slides. This is oftentimes done as part of routine diagnosis. A radiologist will, biopsy a piece of the tumor, and we can use that to tell us what type of cancer type this is. Now, we now know that these histology slides actually contain a lot more information than previously thought. Using advanced, artificial intelligence algorithms, we can use machines to actually learn from these pathology slides. And what we've shown is that we can predict the type of mutations a patient might have, and even predict the expression of certain genes or proteins. Ultimately, we want to be able to implement this tool in the clinical care and use this very cheap and readily available, a few dollars, a histology slide. And as long as you have access to a computer, you can actually make predictions with pretty high confidence on who is likely going to respond to certain therapies. Obviously, this is all still in, very much in the experimental phases, but you can imagine that this requires really thousands of slides to actually train the computer to be able to do these different tasks. So we're leveraging Marathon of Hope data, which has as part of the gold cohort, a complete suite of pathology slides, whole genome sequencing, and transcriptome sequencing, so that we can be able to train our computer models using this very expensive data set.
Just
Another
thinking,
project that yeah, you had a
sorry to interrupt you. Just you're making me think of something else, because I would
Sure.
think that funding might be one of the bigger barriers that you face, right? So that's really, really fascinating that the cost of that kind of test would increase the possibility of testing, right? More efficient testing and testing more often. So that's really fascinating. Sorry to interrupt, but yeah,
No, and that's
thanks
exactly
for
it.
sharing.
It takes literally a few dollars to do one of these slides, and
Yeah.
yes, there is the kind of upfront cost of building these very complicated models, but once they're done, this can be implemented in a very democratic way, across different institutions, and that anyone, any researcher can or clinician can hopefully make use of this. Um, the other project that I'm currently working on is also through the Marathon of Hope. It's a proposal that I recently put forward to the for the Clinician Scientist Award. As I mentioned before, one of the other sites that I treat is brain tumors, and we have really struggled in making any headways in terms of new treatments. For example, there are very few targeted drugs that work in the brain, and immunotherapy, which is now standard of care for a lot of cancers, including colorectal cancer, has not really shown to benefit patients with primary brain tumors. And really part of the challenge is that the brain is a difficult location to get biopsies from. As one can imagine, it is quite invasive and difficult to perform safely. So we've shown that looking at the circulating tumor DNA, we can not only track the tumor evolution in real time, but also try to capture the different types of tumor microenvironments that actually support these tumor cells. So we believe that some of these tumor microenvironments may be actually more suitable for immunotherapy, as an example. One can imagine, given the scale of this project, you really need lots of the data from different places. So I'm collaborating with teams across Canada, from Vancouver and Calgary, as well as a group in Montreal, to hopefully merge our data together. And through the Marathon of Hope's national platform, we're working to try to integrate these genomic data sets. And ultimately, this work will hopefully allow us to build a precision medicine platform to unlock both targeted therapies as well as possibly even immunotherapies in patients with these difficult to treat brain tumors.
Thank you.
It's it's really exciting to kind of hear how you're working through these challenges, and how we can use this machine learning that I know everybody's talking about too, and to better everybody's lives. And I think one other challenge we might be facing is the increased rates of colorectal cancer amongst young people. Can you tell us a bit more about this potential challenge or concerning trend and what may be driving it?
Yeah, great. Thanks, Kristen. Yes, I think this is a really a growing and deeply concerning trend that you highlight. Over the past few decades, what we've seen is a significant rise in colorectal cancer cases, predominantly among younger adults, particularly in those under the age of 50. Traditionally, colorectal cancer was considered a disease of older adults, but recent data really suggests that that incidence and that pattern is changing, and that even though the incidence is actually declining in older age groups, part of that likely due to better screening programs, we see that opposite trend in younger populations. At the moment, we don't have a good single definitive answer yet as to why this is happening. But research suggests that it's likely a combination of genetic causes, lifestyle changes that has occurred over the past few decades, and also certain environmental exposures that, and it's a combination of all of these that may be at play. We think that inheritable causes such as Lynch syndrome, for example, only explain a very small subset of young cancer patients. So this really points to other, more external risk factors like environmental exposures. There is a growing interest in whether early life exposure to certain diets or pollutants or certain antibiotics, for example, or maybe lifestyle like sedentary behavior may be contributing to this increased cancer risk. We are currently doing through the Marathon of Hope is pooling our data with also international collaborators, out of UK and US, and really try to shed light on this issue and try to uncover what might be the underlying causes. So hopefully we'll have some answers, for you in the next few years.
Thanks, Kevin.
That's
Would you be able,
yeah.
sorry,
Oh,
Kirsten?
I just have one follow-up question. Sorry, Sheilah. It's
Yeah.
actually really quite interesting to hear that there's more than just sedentary behavior and that environmental factors or even antibiotics could play a role. So as young adults who experience symptoms of colorectal, so this is just more from my perspective, I guess, because young adults who experience symptoms of colorectal cancer are often dismissed by healthcare providers who tell them to lose weight, change their diet, do more exercise. Um, with that increase in cancer diagnoses among that population, what should people know? How can they better advocate for themselves to get the proper tests and screening so we can catch the cancers earlier? And what can we get clinicians to be, and not what, but how can we get clinicians to be more attentive and to people's concerns about their health, regardless of the patient's age?
Yeah, great, Kristen. Yeah, I think that, that is a great question. And I think you really strike at a very important issue. It's really awareness. And my biggest piece of advice is don't ignore symptoms. I think if someone experiences persistent changes in their bowel habits, unexplained weight loss or rectal bleeding, or abdominal pain that's persistent, I would, speak with the doctor, even if you are young, because I think you really need that medical expertise to kind of help you guide you. I would say that for those with a family history of colorectal cancer or known genetic risk factors such as Lynch syndrome, then definitely early screening and genetic counseling can be life-saving. I think regardless of all that, it's still important to remember that colorectal cancer is still very rare in the young. And we also cannot forget that there are, lifestyle modifications that you can do now to improve your overall health. Things like maintaining a high fiber diet, reducing processed food intake, staying active, and avoiding smoking and excessive alcohol intake. And those are things that everybody can do to try to lower the risk of developing colorectal cancer. To answer the second part of your question, for clinicians, I think what we need is really a paradigm shift in terms of the mindset of the medical community, so that clinicians actually recognize that colorectal cancer is no longer just a disease of older adults, but can occur in the young and with increasing frequency. We are beginning to see a shift in mainstream media, because these reports have been picked up, and we see also some well-known celebrities in their getting colorectal cancer, so that has also raised some awareness. But ultimately, it takes advocacy and platforms like this to normalize discussions about colorectal health and empower patients to really speak up, and most importantly, for clinicians to listen carefully. There are also efforts now to try to update, screening guidelines to decrease the age for screening. So there's also lots of, public health efforts that are underway to try to begin to make an impact. So yeah, there's lots of things that are happening, but I think ultimately, it is about more awareness, and having more discussions like we're having now.
Thanks, Kevin. Sorry to interrupt you, Kirsten, because now that answers my question. My follow-up. The next question is sort of two parts, and it follows in just what you were speaking about. Would you be able to share what the percentage of Canadians that are diagnosed with colorectal cancer that also test positive with Lynch syndrome, which is something of interest to me, because we know that especially women with Lynch syndrome are at a greater increase of developing ovarian and endometrial cancer. And do you think, too, that it's possible that these reproductive symptoms that may appear in young women could be overlooked or dismissed when they actually could be symptoms of colorectal cancer?
Yeah, thanks, Sheila, for that question. So the first part, so Lynch syndrome is also known as hereditary non-polyposis colorectal cancer. It is the most common hereditary syndrome that predisposes to colorectal cancer. What that means is that these are genes that you can inherit from either mom or dad. The lifetime risk of developing colorectal cancer can be actually as high as 60 to 80%. It's a little bit different between men and women. Now, even with this, it counts still for a minority of colorectal cancer cases. About 2 to 5% of all colorectal cancer can be attributed to Lynch syndrome. Now, Lynch syndrome is not a sort of a one gene kind of fits all type of syndrome. There are actually several mutations that can cause Lynch syndrome, and the risks of for other cancers such as endometrial and ovarian cancer are actually quite different depending on which type of mutation a patient has. So I would definitely, speak to your doctor or genetic counselor to get the most up-to-date information because this is not static and these information changes all the time just to find out, what your individual risk is and what type of screening programs you may be recommended for. And in terms of your second question about, the concern regarding reproductive symptoms being overlooked, I do think it's a valid and real issue. Symptoms such as abdominal pain, bloating, changes in bowel habits, sometimes can actually overlap between benign gynecological conditions and colorectal cancer. So I think to address this, I mean, there's no easy answer here, but I think it's crucial for both patients and healthcare providers to maintain a high degree of index of suspicion, especially when young women present with these type of persistent symptoms. Symptoms of cancer, they don't go away. They're persistent and they oftentimes get worse over time. So if a doctor continues to downplay your concerns, in that case, I think the key message is don't hesitate to get a second opinion.
To really advocate for yourself, eh? That's really important. Okay,
For sure.
thank you. Thanks.
Yeah, it's really nice to hear you say to advocate for yourself and get a second opinion when you're unsure. I think that is what I often tell people as well as a non-clinician. So it's really refreshing to hear um, I'm providing the same advice as somebody who's in that field. So pivoting back to the work of the network, what role can precision medicine play in improving outcomes for young patients with colorectal cancer? And what are some questions patients should be asking their oncologist about precision medicine?
Yeah, great questions. I often view my patients as my partners in research. I think ultimately all the work that is being done at the network is aimed at improving patients' lives. So really, you are the most important stakeholder in all of this. Precision medicine has, I think, already transformed how we diagnose and treat colorectal cancer. It's no longer a one-size-fits-all type of approach. But we now have, as you both alluded to, we now have colorectal cancer with Lynch syndrome that dictates a different screening strategy, a different treatment in certain settings, like in the metastatic setting, for example, or colorectal cancer with certain genetic mutations. Now we have targeted therapies now for a lot of the smaller, rarer subtypes of colorectal cancer. I think the bottom line is that there's really a wealth of information out there and new data is coming out all the time. So it's really important, I think, to ask your healthcare provider to kind of help guide you in having these discussions. I think from a patient's perspective, some good questions that you can ask your oncologist, can be, has my tumor been tested for genetic and molecular markers? Because that oftentimes can change the type of treatment or the type of screening that you might need, for example. You can also ask about, are you eligible for certain immunotherapies or targeted therapies? Again, that landscape often is changing very rapidly. And then, should I consider germline genetic testing? And is there funding either through a hospital or provincial level to look for those heritable causes of cancer? And finally, as we're all, I think, part of the research community is, are there clinical trials and research studies that you may be eligible for? Oftentimes that, again, may not necessarily benefit you, and it could, but also it has a potential to benefit, future generations of patients. So I think those are some good questions to start the conversation with your doctor.
Thanks, Kevin. And can I just say on behalf of myself, Kirsten, and everyone in the patient working group, to hear you say that your patients are your research partners is so, so refreshing. Thank you for that. That's huge, that statement. I guess just to wrap up now, if you could leave young adults with one message about colorectal cancer prevention and treatment, what would that be?
Yeah, that's a good question. I was kind of thinking about this. I would say that I think to put it simply, we kind of highlighted some of this already, but you at the end of the day, you know your body the best. So trust your instincts and really advocate for yourself. Colorectal cancer, based on what we now know after many decades of this increasing trend, is that it's no longer just a disease of older adults. Rates are rising in younger people. And too many cases are actually, unfortunately, diagnosed late because symptoms are dismissed or they're attributed to, other conditions. So if something feels off, and as I mentioned before, persistent changes in bowel habits, rectal bleeding, unexplained weight loss, abdominal pain that's quite persistent, don't ignore it. Speak up and don't hesitate to seek a second opinion if you're being ignored. I think on the prevention side, be proactive, maintain a healthy diet, stay active, limit the amount of processed foods and alcohol, definitely avoid smoking, and really also know your family history. If colorectal cancer or Lynch syndrome runs in your family, then definitely talk to your doctor about earlier screening or genetic testing to see if you may be at increased risk.
Thank you.
This has been an absolutely amazing talk. I have learned so much myself. Thank you, Dr. Wang, for sharing your expertise with us. And I truly wish you the best of luck on all your research. So thank you.
I
Thank you.
concur. Thank you very much, Dr. Wang. It's excellent.
Thank you.